watching this video, the clinician will be able to perform Leopold's maneuvers, assess the fetal status through use of Doppler or fetoscope, perform an accurate measurement of the uterine fundus, and make a general assessment of maternal and fetal well-being within the accepted medical parameters.
Hi, Becky. How are you feeling? Baby moving good? Moving at least 10 times a day, really active. You having any problems with swelling? Just hot. Just hot, yeah. What about any bad headaches, blurred vision, spots before your eyes, anything unusual going on?
Position the woman comfortably with a pillow under her head and shoulders. Her knees should be bent slightly, and her arms should be at her sides. With clean, warm hands, prepare the woman, draping her lower body and exposing her abdomen for examination. Be sure the woman has emptied her bladder prior to the examination. A full bladder can make the fundal height seem higher than it actually is. Facing the woman, locate the symphysis pubis and the top of the fundus. Remember, the symphysis pubis has nothing to do with the pubic hairline. Place your hands along each side of her abdomen and palpate to the top of the fundus, noting the size, shape, consistency, and mobility. The part of the fetus that is smooth, firm, and curved is the fetal back, and the small, knobby, irregular bumps are fetal knees, feet, elbows, and hands. This determines the lie of the fetus. You may feel movement or kicking on this side. Grasping the area above the symphysis pubis between your thumb and middle finger, press gently but firmly into the abdomen. This maneuver allows you to ascertain the presenting part. If the presenting part is the fetal head, the mass will be movable and relatable, able to move freely between the fingers, unless it is engaged in the pelvis. Using the combined Pollock grip, you will be able to compare the presenting part with the top of the fundus. If the presenting part is ballotable, and if the top of the fundus moves the whole spine of the fetus, the fetal lie is in the vertex position. Next, facing the woman's feet, place your hands on the lower sides of the uterus with your fingers towards the symphysis pubis. Press deeply with your fingertips into the abdomen in the direction of the pelvic inlet. You will feel a hard, round protrusion, the cephalic prominence. If the head is in the vertex position, it will be well flexed, and you will feel the prominence on the same side as the small fetal parts. If the presenting part is engaged within the pelvic inlet, you will not be able to feel it. A tape measure is commonly used to measure the fundal height. First, locate the woman's superior border or the symphysis pubis at the midline. Hold the zero end of the tape measure here and pull the tape over the abdomen to the top of the fundus. The measurement in centimeters should correspond to the weeks of gestation. For example, 35 weeks equals 35 centimeters. Variables to this measurement include positions of the fetus such as breech, transverse lies, and lightening and engagement. Note that too much elevation of the woman's torso can affect the accuracy of the measurement. Having previously located the back of the fetus during the Leopold's maneuvers, you will be able to judge with some accuracy where to listen for the fetal heart tones, or FHT. For a toned fetus in the vertex position, you can locate the fetal heart tones below the umbilicus on either side of the midline, the left or lower right quadrant, LOQ or RLQ, depending on the lie. For a fetus in the posterior position, fetal heart tones are close to the midline or in the flank area, in which case you will be listening to the fetal chest.
Have to be sure and get the gel off. And I always like to assess the weight of the baby toward the end of the pregnancy. I think this baby is about 6.5 pounds right now. We're about 3 weeks away from her due date, so probably have about an 8-pound baby if it comes on time. All right, do you have any questions, Becky?
Do you think it's going to be an 8-pound baby?
Well, if you have it on time, I think it will.
Yeah.
Hi, Jennifer.
Hi.
How are you doing today?
Pretty good.
Baby moving good?
Active.
Real active, that's what I like to hear. Are you having any problems? Swelling?
Just a little.
Just a little. Any severe headaches, blurred vision, spots before your eyes? Okay, well let's check in. See what this baby's doing today. Starting at the bottom of the fundus, assess the fundus until you, the uterus until you find the fundus, the top of the uterus right here. Feeling the baby's back, mostly on top. This feels like a fetal head right now. I think this baby's in the breech position. And this is the baby's bottom right down here. So the baby's curled up this way. And you should hear fetal heart tones right about here.
The fetal heart tones of a breech presentation will be level with or above the umbilicus.
Okay. Starting from the top of the pubic bone, very superior portion of the pubic bone to the top of the fundus. The baby's position can have a great effect on the fundal height measurement. Breech, transverse lie, when the baby's head is on one side and the baby's bottom is on the other, you get a much smaller fundal height measurement. So whatever position the baby's in can make a big difference in the measurement that you get each time. It's best if the measurement's taken by the same person every time. A lot of kicking and moving over on this side. Oh, probably a lot right down in here. Has anything changed?
Look, I dropped down here.
Good. That's always a good sign. This baby's laying. The sides that I can feel a little fat or something over here.
Right up in my ribs.
Baby's bottom is right up here. Looks like we've got back pretty much coming across the top.
Press deeply with your fingertips into the abdomen in the direction of the pelvic inlet. You will feel a hard, round protrusion, the cephalic prominence. If the head is in the vertex position, it will be well flexed, and you will feel the prominence on the same side as the small fetal parts. If there is a face presentation, you should feel the prominence of the occiput on the same side as the fetal back. If the presenting part is engaged within the pelvic inlet, you will not be able to feel it. This position is referred to as dipping.
See where our measurement is this week. So Sometimes as the baby's head gets slower, the measurement goes down a little bit instead of up. You're right on there.
Be sure to record all the findings on position, measurement, and fetal heart tones rate and location for future reference and comparison.
Baby's head is really low. It's under the symphysis pubis, what we call dipping down.
From your assessment of fetal status, you may also be able to estimate fetal weight.
I think we've got about an 8-pound baby here right now.
The mother's heart rate by Doppler or fetoscope will be much slower and make a swishing sound. If you are unsure whether you are hearing the fetus or the mother, check the mother's radial pulse as you listen to the heart rate. Once you identify the fetal heart tones, take a moment to assess the rate and strength of them. Fetal heart tones are rapid and deep, usually around 130 to 160 beats per minute.
Everything looks really good. Okay, do you have any questions?
These visits also provide an opportunity to discuss the overall health of the mother. General physical feeling, genitourinary status, edema, nausea, energy or fatigue level, nutritional intake, account of fetal movement, and any concerns of either of you. Vital signs and urine tests are necessary at each visit. Share your findings with the woman and be open for her questions. Communication is key in establishing confidence between you and your clients.